How do social and economic status affect health outcomes? So we've been talking in this class a lot about inequity, and we've looked at it in terms of power, especially about how it relates to us in the United States. But of course, when we think about inequity, we can think about people all over the world in different societies with different forms of power structures who also face forms of inequity. In the United States, however, when we think about people who subsist at lower economic levels, we see very clearly health inequities. So what that means is if you're brown or Black, evidence shows that in the United States, you have poorer health outcomes, meaning more illness and higher mortality rates than non-Black or brown folks. So one way to think about this is with the term structural violence. And structural violence is similar to or related to structural racism, and is actually, it encompasses sort of a broader term. So structural violence, this is all the ways in which the existing structures, be they racist, discriminatory, or prejudicial, all the ways that those structures in society create inequities in terms of outcomes for people. And it's referred to as violence because it can, in fact, shape people's health outcomes. So one of the things that we can look at right now is the impact that is different of COVID-19 on lower income folks, on Black and brown folks. And also we can think about it in terms of Native Americans and First Nations people who have suffered quite a bit and at a very, very high rate from COVID-19. So in April, when this first started, there was already a very clear higher proportion of African American patients with COVID-19 and especially deaths than non-African American people. So if you look at this graph, what this is saying is, for instance, in the state of Louisiana, 32% of folks in Louisiana are African American. However, of the people who have died from COVID, African Americans make up 70% of those folks. So totally disproportionate to the percentage of African American people in the state. In the city of Chicago, at the bottom there, African Americans make up 30% of the city's population. And again, 69% of the deaths are African American people from COVID. So, you might question, well, what's going on here? We're all human. We have the same biology. We have 99.9% of the same DNA. What factors are causing certain ethnic groups to, or certain races, if we want to use the social term, are causing higher mortality rates, right? And the evidence tends to point to, these structural discrimination, not only in healthcare, because I don't want to blame healthcare. In hospitals, the staff, people are doing the best they can, of course, for everyone. But there are many, many reasons why, say, a person can't take time off of work to go get tested. Do they have testing that is close to them? Is it free? Who's going to watch the children while they go do this? When they get sick, do they leave the house? Do they trust hospitals? Do they trust doctors? What underlying conditions are already there based on other, structural issues like poorer nutrition due to generally lower incomes and more processed foods. So, there are many, many cultural and social and economic reasons why these kinds of health outcomes exist. They are not biological. The picture in the middle are just some of the things that we can think about that are the stressors or that influence the health outcomes of diverse ethnic or racial groups. Things like racism, things like discrimination, poverty, and violence. And that all, fits into what we were talking about previously with poorer health outcomes. This adorable little baby here is a reminder to me that I wanted to tell you about a particular study that looked at, after 9/11, it looked at the impact on birth weights of mothers who were giving birth within 6 months. So they were already pregnant when 9/11 occurred, giving birth within 6 months of the events of that day. And some of you I know maybe weren't even alive then, which is appalling. No, I'm just kidding. But there was a lot of sort of sudden and unsubstantiated racism and discrimination and even hatred that bubbled up and spilled over into violence and racism and stress and hate crimes, graffiti towards Arab peoples and Muslim peoples, and even Sikhs who are not Arab or Muslim. They are of a different faith, but they wear turbans. And since turbans are often associated in the media with Arab peoples, Sikhs were also targeted. So what this study found was that the birth weights of mothers with Arab sounding last names were significantly lower than women without Arab last names, meaning at least this study pointed to the potential that due to racism and other stressors targeting Arab and Muslim communities and people, the mother's health suffered due to this chronic stress or even acute stress, and affected the birth weights of their babies. Right. So there are many examples that we can look at in scientific publications that don't always make it out to the media, that show that racism and discrimination leads to health inequities. It leads to actual physical responses, right? So it's not just something that affects us socially or emotionally or culturally. It also affects us in biocultural or physical ways.